I will now examine my patient's eyes. I will first look at the size and symmetry of the eyes, comparing both eyes, and then checking the sclera if it is white, and it is. For the conjunctiva, I will take a closer look by asking my patient to slightly tilt her head back. I will draw the lower eyelids down, and I'm looking at the conjunctiva, and it is clear on both sides. Now I will check my patient's visual acuity by using my Snellen eye chart. For this eye chart, I'll be standing at least 6 feet away from my patient. I will ask my patient to read the smallest line in which she can read the letters.
D, E, F, P, O, T, E, C.
Okay, she's able to accurately read all the letters in that line, which is the smallest line. So I will use the number next to that line for the visual acuity. So my patient has 20 over 20. Make sure to understand what both numbers mean. The top number being the distance in which the patient can read the letter, and the bottom number being what a patient with normal vision can read the letters. After visual acuity, I can now check my patient's accommodation. To do that, I will use my index finger and have my patient follow my index finger as I bring it close to her nose. Now bring it back. Both eyes are able to focus on my fingers, so my patient has normal accommodation. I will now check my patient's light reaction. For that portion, I will use my ophthalmoscope. I'll make sure the light source is on. I will first shine the light into my patient's left eye, checking for pupillary constriction on the right, and there is constriction, so that's normal light reaction. And now I will shine light into my patient's right eye, checking for pupillary constriction on the left, and indeed there is. Now I would check for my patient's red reflex. I'll take a closer look, looking for that red-orange glow. And once I locate the red reflex, I will examine my patient's eye closer. And I'm coming as close until I'm almost touching my patient's eyelashes. And I'm locating the blood vessels, optic disc, macula, and fovea, which all appear normal. Please make sure to hold your ophthalmoscope laterally, only 15 to 20 degrees. And then if you are examining the patient's right eye, use your right eye, and for the left eye, to use your left eye as well.